I am Dr. Chandra Jayasuriya, consultant ENT surgeon for the National Hospital of Kalana. I have a special interest in vertigo. So I am going to introduce a series of vestibular exercises which can be practiced by patients with vestibular disorders. These exercises can be practiced by any age group, also unilateral or bilateral vestibular pathology. These exercises will improve the remaining vestibular function. When we have a vestibular disorder, we are reluctant to move. Some people are homebound, they don't go to work, they get depressed. But we all have vestibular function, little remaining vestibular function with any vestibular disorder. So when we practice these exercises, new pathways will develop in the brain. And when we do more and more exercises, our confidence will go up and we can continue our day-to-day exercises as any other normal individual. These vestibular exercises may increase your dizziness initially. So some people tend to avoid these exercises. So my advice is to start these exercises slowly with an accompanying person. When your confidence is increased, you may do them on your own. When you are doing walking exercises, better to walk near a wall. So if you feel imbalanced, you can touch the wall. Or alternatively, you can do the exercises in front of a table. So when you feel imbalanced, you can touch the table for a short period. Exercise number 1, patient has to stay hands together, feet together and close your eyes. So there should be a helper to support the patient. Now it will increase the confidence of the patient, but we are not touching the patient. Keep with the hands away from the patient. Exercise number 2, hands together, feet together, close your eyes. Now I am keeping your hands in front of you, my hands in front of you. You raise your right leg and try to remain in this position. Initially it will be little difficult, but don't worry. Initially 5 to 10 seconds, but gradually increase your time. Now keep your right leg down and now do the same thing on the left side. So eyes closed, left leg up. You have to keep it like in this position for 1 minute, but now you can keep your legs down. Exercise number 3, we are going to do exercise number 1 and 2 on a foam cushion. So first thing, you keep your hands together, legs together, eyes closed. Because it will be little difficult on the foam cushion, I am going to keep my hands covering the patient and try to increase the time up to 1 minute. Exercise number 4, we are going to repeat the exercise number 2 on the foam cushion. So keep your eyes closed. Now raise your right leg. I am going to balance you, don't worry. And stay in that position at least 5 to 10 seconds. You can increase the time. Okay, repeat the same on the left leg. So he is going to stay. Now she has stayed for about 10 seconds. Don't worry. Try to improve. You are with you, don't worry. So she has stayed for about 10 seconds. Okay, right. Now we are going to do exercise number 5. This walk is called heel to walk. You have to do it eyes open. Heel toe means I am showing my hands. This is the way you have to walk. Heel to toe. Now you have to walk heel to toe. This walk, as a medical term, we are calling it tandem walk. Now you are walking heel to toe, eyes open, about 6-7 steps. And now when we ask you, you have to turn and again do the same heel to toe walk. I'm going to keep you balance with my hands, so don't worry, you are not going to fall. Same thing you have to repeat 3-4 times, and again you can do the same. We are going to do the exercise number 6. Repeating exercise number 5 with eyes closed, tandem walk. Now Yasaswi, you go about 10 steps forward, heel to toe. I am going to be with you, don't worry. Eyes closed, tandem walk. This can be done about 10 steps. Now you have to turn and go back with your eyes closed, tandem walk. This exercise has to be repeated 3 to 4 times when we are doing at home. Repeating the number of cycles will increase the confidence. Exercise number 7, walking tandem, heel to toe walk on the mattress, eyes open. You have to go forward and backward. We have to repeat this exercise 3-4 times to increase the confidence. At home, we can do it near a wall, so the patient can touch the wall when we do the exercise. Exercise number 8, we have to do the tandem walk on the mattress with eyes closed, and again we have to do 3 to 4 cycles to increase the confidence. Tandem walk, eyes closed. We have to repeat this exercise 3-4 times to increase the confidence. And I am going to be with the patient, keeping my hands to support. Exercise number 9, Yasaswi, you have to walk forward while looking at right and left alternatively, like this. Now you have to walk while looking at right and left alternatively. This is called super tail walk. We are looking at what's in the right and left. So, and you have to go back again and then do the same thing, turning right and left alternatively. Exercise number 10. Now we have to walk forward while looking up and down, like this, up, down, up, down, up, down. Now you can walk. You have to do the same toward the other side. Again, we can repeat the same thing 2 to 3 cycles. The final exercise is card exercise. These exercises I will demonstrate while I am seated, and then we have to do these exercises while walking also. For this card exercise, we use a card like this with a handle with the letter drawn. A is drawn, so this is easy to focus. Alternatively, we can use a bank card also, because sometimes it may be difficult to find a board like this, but the bank card also can be used. But with little effort, we all can make something like this. It is easy to hold and do the exercise. In the first exercise, we are keeping the card straight. I will move my head from side to side while focusing at this card. Second exercise, I will keep my head straight, but I will move the card left to right, but still I will always focus at this card. The third exercise, I will be moving my head and the card in opposite direction. Always I have to focus on the card. Now my head is to the right, but card is to the left, but eyes I will focus. Now again my head is to the left, card is towards the right, but I am focusing with my eyes towards right. So I will do alternate head and hand movement like this. I will keep this card at my eye level. Now I will move my head up and down. Card is stationary and my head is moving up and down. The second exercise is, I will keep head straight, but I will move the card up and down. Always I will focus at this letter. Third one, I will move the head up, but the card is going down. Slowly I will move the card up, but the head is going down. Always eyes at the card. Alternatively, we can do this with the bank card also, like this. Now Yasaswi, I have demonstrated what to do. Now you have to do the card exercises, moving card and the head right and left. The first one. Now the second one. Move the card. Head straight, move the card. Now the third one, you move the head and the in opposite direction. Right? Now. Right. Okay, you understood it very well. The next one is moving up and down. Card and the head moving up and down. Now you first keep the card straight, move your head up and down. Right. The next one is to keep your head straight, move the card up and down. Don't move very far, and like this. Last one is little difficult. You have to follow my instruction. You move your head up and eyes down. Head up, eyes down. Now the head is like this. Oh, okay, you understood it very well now. Keep on doing it. Right, okay, right. Now our aim is to do these exercises while walking. It is little difficult, but all the exercises are meant to be practiced slowly. So the most difficult exercises is doing the card exercises while walking. So we are not aiming to do these exercises at one stretch on the go same day, but we can do every exercise. Once we practice one exercise, we can go to the next one. And time also has to be increased slowly with these exercises. And for the balance, to improve the balance, we can keep a chair or table in front of you. If you feel that your balance is not very good, you can keep a finger on the table or the chair. So then your confidence will be improved by touching an object. But slowly you have to remove your hand from that object. But to improve your confidence, you can keep a finger once in a way. Final exercise, you have to practice the most difficult card exercise while walking. So you have to move your head up right to left and card left to right.